Thanks very much, Jordan. As MPs flocked back to Queen's Park yesterday following a lengthy break, the Ford government announced it was bringing in a former federal Liberal health minister to address problems with access to health care in this province. According to the Ontario Medical Association, 2.5 million people do not currently have a family doctor. So joining us live now is Dr. Jane Philpott, the new chair of Ontario's Primary Care Action Team. Dr. Philpott, thanks for joining us.
It's my pleasure.
We'll start off with that number. I mean, it's quite a daunting task you have there. 2.5 million people currently without a family doctor, according to the OMA. But that number could increase to 4 million over the next couple of years. How do you keep up with demand, and really, where do you start?
Well, it's absolutely a daunting task, and that certainly speaks to the urgency of getting started immediately on this mandate that I've been given to work with a team and work with the government to ensure that every single person in Ontario has access to a primary care clinician, whether it be a family doctor or a primary care nurse practitioner working in a publicly funded team. And we've got a huge gap to fill, but we need to get started. It is possible to do this. Many other countries have a guarantee of access to primary care, something we've never seen before in Canada. But if we don't fix this quickly, it will lead to a lot bigger problems down the road.
Well, the province says that you're going to be implementing and using the Periwinkle model, something that you devised to help everyone access primary health care in the Kingston area. Can you explain a little bit of what is behind that Periwinkle model, what it's about?
Well, there are many models in terms of how you put together a primary care team, but the basic concept is the idea of having what we like to call a health home in every neighborhood, and where every person is assigned to a health home just as automatically as every child is assigned to a public school. You don't need to worry when you move around the province whether your children will be able to get into school, but people sure do worry when they move somewhere whether they're going to be able to find a family doctor. So the idea is to develop these models where we have family doctors working alongside nurses and nurse practitioners, sometimes dietitians or social workers, and based on your geography, you will have a guarantee of access to a team that will be able to provide your ongoing health needs in a comprehensive way, whatever it is that you need for care.
Yeah, and we know that you wrote a book about this, Health for All. So this is something that's completely right up your alley when it comes to trying to connect people to primary health care. But was it tough for you to put aside, political stripes in this case? You being a former federal Liberal health minister, as well as being the keynote speaker at Ontario's Liberal Party's policy convention last month. Was it tough for you to do?
It's a great question, but the reality is that healthcare should not be partisan. It is something that's incredibly important to every single person in the country, and I am going to be working with the Ontario Public Service. I am prepared to help any government of any political stripe who is determined to try to make sure that everyone has access to primary care. And this opportunity came my way to be able to deliver on the vision that is shared by myself and many other colleagues and advocates for primary care access. And so I'm really looking forward to being able to have the tools to deliver for the people of Ontario.
Now, the leaders of two opposition parties yesterday both said that they have, high respect for you. However, they have concerns that the province will listen to your recommendations after being a part of this primary care action team. Do you share those concerns?
Well, I understand those concerns because we have a history in Canada of getting wonderful reports written going back decades describing what should be done for healthcare, and then these reports sit on the shelf. I'm happy to say that I have not been asked to write a report. I've been asked to actually put into action what we already know about what works. And so the work is very implementation oriented, and it will be I will have the resources to be able to add to family medicine teams that already exist in Ontario, to be able to build their capacity so they can take on more patients, but also to, in some cases, start brand new primary care teams in communities where there are sometimes tens of thousands of people who don't have a family doctor. And so this will be very much something that will have results to show very quickly, and it's certainly important for us to do as a province.
All right, December 1st, the big day when you start. Dr. Jane Philpott, thank you so much for joining us this morning. We appreciate it.